Hey, good morning, man. How you doing? Anyways, my name's Cheyenne. We'll be your student nurse today. So while I'm getting all my gloves together, you can go ahead and tell me your name and date of birth. Awesome. I'm just going to confirm that in the system. Awesome. So the doctor went ahead and ordered to get you a nasogastric tube, just N.G Tube for short. Basically, all that is a little tube that's going to go up your nose, down your throat, and into your stomach, because you're not getting enough nutrients. Real quick, can you tell me, do you have any allergies, maybe latex, or any past like nasal surgeries I need to know of? No? Perfect. I'm going to go ahead and raise you up to a high Fowler's position just to make this nice and easy for me. And I got all my stuff ready, so we'll make this procedure real quick and real painless, I promise, man. Okay. Just a little bit. There we go. I'm going to go ahead and remove that pillow from your man. Not a big deal. I'll get you back up in 2 seconds. So, what we're going to go ahead and do, I'm going to go ahead and set you up right here. In case you get messy, we have this innocent basin just in case you get nauseous and want to throw up. And I'm going to leave this water right here just in case. Well, I'll show you what that is later. So, this is the N.G tube. Real small, nothing to really worry about. But before we get started, I'm going to go ahead and see which nair is going to be the best. So go ahead and breathe in for me. All right, awesome, super. Breathe in for me. Awesome, it looks like your right nair is going to be what we need to use. So we're going to go ahead and measure this guy from the tip of your nose to your ear and all the way down to your xiphoid process. You're all right there. Go ahead and mark that guy with a piece of tape. Boom. Okay, awesome. We're going to go ahead and get this guy lubricated 2 to 4 inches just to make the insertion a bit easier for me and you. Boom, I'll lube this up. If at any time my patient experiences respiratory distress, cyanosis, or the inability to speak, we're going to immediately stop the procedure. All right, man, do me a favor. I'm going to go ahead and have you tilt your head back. I'm going to slowly insert this guy in there. Awesome. Good, relax, 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 relax. Okay, we're experiencing a bit of resistance. I'm gonna go ahead and check and see if this guy's in the frame rates. All right, looks good to me. All right, what I'm gonna go ahead and have you do, we're gonna have you tilt your head down, put your chin to your chest, and every time I say swallow, I want you to take a sip of that water, okay? Ready, swallow, swallow, swallow. Now, due to this being a mannequin, it's not going to go all the way through, but for this purpose, we're going to say that it hit. All right, awesome. We're going to go ahead and tape this guy down to your nose. Okay. Which part's almost over? Don't you worry about it. All right, got that secured. I'm going to go ahead and tape this guy to your shirt. Right there. And in order to go ahead, before we get you set up for feeding, we're going to go ahead and send you off to x-ray just to make sure the tube's in the spot that we want it, because it needs to be in your stomach for this to come out. So whenever we send you back to x-ray, we'll get everything taken care of in there. Wait a second. Okay, cool, x-ray confirmed, everything's looking good. We're going to go ahead and remove this guided wire. We're going to plug you up for feeding right here, and I'll be right back. So right there. Hey, it's Cheyenne again. I'm your student nurse. We're going to go ahead, doctor gave orders to go ahead and remove that N.G tube. And go ahead and confirm your name and date of birth. Awesome. I'm going to confirm the doctor's orders. Okay, awesome. We're going to go ahead and remove that N.G tube out of you. I know you're so excited. I'll go ahead and unplug it from feeding and unplug it from your shirt. Okay, this is where we're going to need a little bit of teamwork. We'll ask you on 3 to hold your breath, and I'll get this out in 1 fell swoop. Okay, 1, 2, 3. Awesome, you did great. I know you're ready to get that out of there and get right back down to relaxing and watching TV. Let's go ahead and get everything cleaned up from here. And I'll go ahead and get you set back down. Made that quick and painless. Let's go ahead and get your pillow ready. Okay. Here's your pillow, man. See, wasn't that bad. All right, man, I'm gonna get out of here. It's good taking care of you, and you get to feeling better soon, all right?